Got it. Welcome and thank you all for joining us today for the meeting of the New York City Health and Hospitals Audit Committee. Today's meeting is officially called to order. I would first like to propose a motion to adopt the minutes of the Audit Committee meeting held on March 22nd, 2022. I'm going to poll each member individually. Jose Pagan,
Yes.
Dr. Katz,
Yes.
Rita Wang, Fenioski Peñamora, he's not on today, Anita Kawatra.
Yes.
Terrific. So the minutes of the March 22nd minutes are adopted. Next on the agenda is the 2022 Annual Audit Plan presentation by Mr. Wyman and Ms. Rudinsky.
So just one person at a time.
Oh, good morning, Jay Wyman, Corporate Controller. I'm going to give this presentation over to Grant Thornton. This is one of three general required communications to the board. This is the audit presentation at the beginning, their plan. They'll come back at the end of the audit to present the findings of the financial statement, and then one last time for the management letter, which will be in November. So this is the beginning of the audit, so I'm going to turn this over to Tammy Rudinsky.
Okay, thank you. So good morning, everybody. Hope everyone had a nice Mother's Day, nice weekend. I'm Tammy Rudinsky. I'm the audit partner from Grant Thornton. I have Steve Diagardi with me here today, who's our manager. Oh, great. Well, thank you. And we're here, as Jay said, to present the audit plan for the June 30th, 2022 financial statement audit. So really happy to be here today. With Steve and myself, we have a continuity of team members, Lou and our managers, Ray and Chris, in that as well. So the good news is a lot of continuity on our side, and we're looking forward to work with Jay and James and the entire team. So hopefully you can see with you, or you've had a chance to look at the presentation. Just trying to, sorry, I think I went a little too quickly. Sorry, getting used to this little thing. Okay, great. So this slide outlines our responsibilities as it relates to the various deliverables that we present to the committee. And as Jay said, this is our planning presentation. We'll come back and we'll go through our timeline and present to you the results of the financial statement, the various audits, as well as the management recommendation letter. So our responsibilities, as outlined on the slide, is to perform an audit on the New York City Health and Hospitals financial statements for June 30th, 2022, as well as the Accountable Care Organization for June 30th, 2022, the Metro Plus, which is our calendar year end, as well as the insurance company. In addition, there's lots of different reports, the annual reports of ambulatory healthcare facilities and the residential healthcare facilities, multiple for each one of those. Those are also for a June 30th year end. And please feel free to stop me if you have any questions throughout the presentation. The next slide outlines the responsibilities of those charged with governance, so the committee today. So as we plan a risk assessment for the financial statement audits, we just want to outline the responsibilities, such as the committee's responsibility to oversee the financial reporting process, discuss any accounting matters or internal control matters, and inform us of anything relevant to the audit. So really at this point, I like to pause and ask if there's any fraud or anything that we should be aware of, that we should consider as we put together our risk assessment and our annual audit plan. Great. And this outlines management's responsibilities. So working with the financial statement team, with Jay and James, they're responsible for preparing the financial statements, communicating any significant accounting matters. We'll discuss 2 GASBs that are applicable for this year, informing us of any fraud and adjusting any financial statements to correct misstatements, and informing us of any subsequent events. And at the end of the audit, they'll provide us with written representations. These next 2 slides outline the timeline, very similar to the prior years. Again, we have pretty succinct timeline, starting with our client continuance, which we've already started today, but most of those processes occur in May, in the spring time frame, and then moving into the summer into June, we perform our preliminary risk assessment procedures, having meetings with management, discussing anything new that we should incorporate into our audit procedures and testing. followed with our interim field work, final field work, and presenting the deliverables to the committee around the second week in October, as Jay mentioned. And then subsequent to that, we follow up in, I would say December, January, more like December with our management letter, and then starting our Metro Plus health plan, as that's the calendar year end, and taking us through already next spring with the certification of those cost reports. Any questions? Okay, Steve's just going to high level walk you through some of the areas of focus as it relates to our detail testing procedures.
Great, thank you, Tammy. So on the next couple of slides, as Tammy mentioned, there's several audit areas that I will walk through and highlight our procedures that we perform. Before we get into that, though, I just want to point out that each time we go into an audit, we gain an understanding of management's financial statements, the activities that have occurred throughout the year and the various different transactions, and we develop a customized audit plan around those different types of transactions. However, the majority of the financial statements do remain unchanged in terms of the types of transactions and accounts that we encounter each year. And that's what I'm going to walk through now, is those, the typical types of transactions. The first area I want to highlight is patient accounts receivable and patient service revenue. We spend a significant amount of time here. It's one of the, by far the largest line items on your financial statements. And we really spend a lot of time gaining an understanding of management's methodologies for determining any allowances and reserves against the receivables and related revenues, understanding the underlying assumptions, and performing tests of those assumptions to ensure that they're adequate and reasonable. In addition, we perform medical record testing over a sample of patients to ensure that the visits and the treatments that they received actually occurred and that they were billed for properly in the course of the normal services. And then also we perform a hindsight analysis of prior periods estimates, the receivables and the allowances against the receivables, to ensure that management's process in the past has been adequate for determining those receivables, the collectability of the receivables is reasonable, and then really factoring any different changes so we can determine how that would affect the current year receivables. So we look at how they did in the past and apply that to the current year receivables to make sure that they're reasonable and accurate. Next item I want to touch on is the estimated settlements due to third-party payers. By and large, these are settlements that are due to many times the government payers, so Medicare, Medicaid, and it relates to a lot of the cost reports that are filed each year. The federal government's many times, many years behind in the current year. So there's these liabilities that carry from year to year, and we review management's estimates, any changes in the liabilities from prior years, and also looking at the new estimates. What are those underlying assumptions that management's using? We'll perform testing of those assumptions to make sure that not only do they seem reasonable and accurate, but that they also line up with what we're seeing elsewhere within the industry. So this is where we look at kind of an industry holistic view and ensure that what we're seeing is consistent across the board. Moving on to net pension liability and Oped liabilities, these again are very significant line items on the financial statement, and also very subjective areas that are really based on management's estimate with the with the usage of actuaries to determine the overall liabilities and the related expenses. As the auditors, what we do is we gain an understanding of, again, what those assumptions that are used by the actuaries are, and also how those, again, line up to what we're seeing within the industry. Some assumptions that we typically see are things like the discount rates, trend rates, cash flows, things of that nature. And we'll look at what is being used by the organization, and how that compares to what other organizations with similar type of pension plans are using, similar type of demographics where these assumptions would be equally applicable. And then we also perform testing of the underlying participant data to ensure that the data that's being utilized in determining these estimates is accurate and complete. Moving on to the next slide. Management override of controls. This is an area of what we call presumed fraud risk. This is something that's overarching in all of our audits. There's always a underlying fraud risk related to management override of controls. And what that means is there could be in any organization, there could be certain factors within the environment that may allow management to, to overcome whatever controls are in place. So what we do is we review to make sure that the risk of that is either, very limited or non-existent. So things that we look at is the entity level controls. Those are the controls, the things I tone at the top. Do they have the proper, committees in place and reviews and, at the high level of the organization. This is also inclusive of information technology controls. Are the appropriate information technology controls in place to help mitigate, risks of the of management override controls? And then, we dig into some of these other procedures that we perform, which we would say are fraud procedures. Tammy performed one of the very first procedures. It's inquiry, right? We asked the committee here, is anybody aware of anything that the organization has experienced that might be related to fraud or presumed fraud? We ask management the same question throughout the audit, various levels of management across various different departments. We'll ask the committee again at the end of the audit the very same question. And then we also develop certain procedures to help, identify if there is any indication of fraud through review of journal entries and various other procedures. Moving on, I mentioned, accounting estimates. I went through the most significant estimates. Really, just the last thing I want to touch on with estimates is it's really a focus on the underlying assumptions. And that's where there could be the subjectivity in, whether the assumptions are conservative or perhaps being a little aggressive. And that's where we really spend the most of our time, is understanding and testing of those assumptions that management's using. And then lastly, on financial statements, we review the financial statements to ensure the adequacy of the financial statements. Not only are they adequate, but are they complete? Are all the required disclosures included? And is the data within those disclosures accurately reported? Moving on to this next slide. As I touched on, the previous items I touched on were the most significant areas. We do perform procedures on a whole host of other areas of the financial statements. To name a few, we have, cash accounts where we perform confirmations. We test fixed asset additions and any types of disposals, as well as any potential impairments of those assets. We review debt, including confirmation of debt. And then also perform and identify non-routine transactions. So this is what I alluded to earlier on. There might be transactions that have occurred throughout the course of business in the current year that might not have been something that's either we've experienced in the past, the organization has experienced in the past, or that we typically audit, but because of the nature of the transaction, whether it be material or due to risk, we will audit those transactions. This is where over the next couple of months, we'll sit with management and really understand everything that's kind of occurred throughout the year. Some of those discussions have already started. So this is a year-long process. So again, it's not just these areas that I'm talking about. We look at everything that's happened throughout the year, and we develop the audit plan accordingly. I'll turn it back over to Tammy, who will take us through the remainder of our presentation.
Any questions from the committee? Okay, great. So the next slide just highlights our technology support. So as part of our audit process, there are certain systems that the organization uses that we test those controls in order to rely on those reports that come out of the systems and perform our detailed testing. So we have a technology team who focuses on healthcare, and they look at those financial dependent information technology systems for us to test as part of our audit procedures or for their team to test. This next slide, this is probably already year 2 or 3 that we've talked about this COVID and the impact, so I won't go into these in detail, but just I think the message here is that as a result of COVID, there's been a lot of focus on different types of risks that otherwise we might have not looked at in the past. So, especially looking at some of the receivables, going concern evaluations, and reserves, and the impact that COVID might have had in each of these individual areas. Asset impairments is one that's been popular in some of our clients. So not every one of these is relevant to New York City Health and Hospitals, but we will consider each of these as we perform and plan our risk assessment and perform our audit procedures. So just jumping ahead a couple of slides. The good news here is, all 10 or 11 of these on these next 2 slides is not necessarily relevant to New York City Health and Hospitals for the next year, but 2 of them I just want to point out that could be or could impact the organization. You could see changes in the financials. The leases and the accounting for interest. The leases is probably the bigger one. Jay and his team is working with a third party to assess the impact to the financial statements. But essentially what this new GASB is saying, and we've talked about this in the past, it's kind of hard to see the slides. I think it's just half showing. I don't know if there's a way to fix that. But basically what's happening is in the past, there was a or difference, I would say, by how you're recording the operating leases and the capital leases on your statement of financial position. So going forward, as a lessee, there's going to be a right of use asset and liability that the organization needs to assess, impact, and then record on the statement of financial position. So you will see this right of use asset and a corresponding liability to your balance sheet or your statement of financial position. And the organization just needs to think through the different impacts. Does it impact your debt covenants? And just thinking through all those different scenarios. So I know they're working with a third-party consultant to assess the impact, and then we'll come back to you, obviously, at the end of the audit with the results and how that looks different this year on your financial statements than it has in the past. So that's, I would say, the biggest one. And all the others are really just for your entertainment, your reading. As you think through the next couple of years, who knows, they can change the reporting requirements and deadlines. I won't go into and bore you with all of them, but we just put it here more for information purposes. So with that, we've concluded. Is there any questions that you have on our plan?
Yes, this is Feniowski. May I ask a question?
Please do.
Okay. What will be the net impact of these accounting changes to us? I don't think I understood clearly.
So I could start. We don't know the dollar value of the impact at this point, but now all of your leases are now recorded on your statement of financial position, your balance sheet. So your operating leases, which in the past have been more footnote disclosure, you're going to reflect on your balance sheet. You have to calculate a right of use asset and liability. So the impact could be, if you have financial debt covenants that, maybe look at asset to liability ratio or stuff like that, it could impact your financial statements or your covenants or something like that. I don't know the dollar impact. Management's still working through that, and we'll come back to you in terms of the materiality of it.
Yeah, this is Jay. So the impact, definitely, as Tammy said, is on the balance sheet. We're going to pick up stuff that we never picked up before, and it's going to be a right of use asset. So if we had a typical lease that was $100,000 per year for 5 years, all of a sudden we have this asset for $500,000. That's new, right? The expense which we used to incur every year, let's say $100,000 in this example, is still going to pretty much be what we're expending, but it's the asset. In our preliminary calculations, we don't think it has an impact on the bond covenants, but we're going to see what it comes to, right? But of course, this does change the calculation for the balance sheet, right? And the bond covenants never considered this. And typically, in the past, we've always had this issue that if we have a change of accounting method, that should also, change the bond covenant. So we don't think that it's going to have an impact on this.
Thank you. I have a follow-up question. This is only applies to the lease that we hold for some of our assets. That means that non-for-profit or anyone uses any space in our facilities. Is that correct? The leases that we incur of renting a space for one of our clinics or that's already in our accounting system. So there is no change there, or is there going to be a change also in how you account those type of leases?
Unfortunately, it includes all of our leases and things that we typically don't even consider leases. So there are these concepts of embedded leases. If you have a contract with somebody that also uses equipment that's solely for our purpose, they consider that an embedded lease. It's very complicated and something that we've spent now at least a year and a half going through every single contract to assess how we have to account for it. But it includes leases. It includes those that lease from us. So it's really pretty extensive. This is probably the most extensive change in accounting probably in the last 20, 30 years.
Oh, wow.
My final question, I'm sorry for all these questions, but we see a lot of the leases that people lease from us in the capital committee. And is there something that we should be aware of these accounting changes when we are looking at new leases, or we should continue business as usual?
I would say, continue business as usual. This has a lot to do with the disclosure within the financial statement. It may change in the future some of the agreements to spell out certain aspects of the agreement, so we readily have the information to report on. But I don't think it really changes the operation. But it does, change the reporting for sure.
Okay, thank you.
Thank you, Finney. Are there any other questions? Okay, since there are no other questions, I just want to thank Jay, James, Steve, and Tammy for the presentation. And we move on to the next agenda item.
Good morning, this is Catherine Patsos, Chief Corporate Compliance Officer, reporting on internal audits, starting on page 3 of the presentation. The first item has to do with the New York City Comptroller's Office audit of nursing home equipment, particularly PPE, personal protective equipment. On March 18th, we had a meeting with the Comptroller's Office to continue discussing their preliminary findings that they had presented to us. And then on April 19th, they sent us an updated summary of findings with regard to Carter specifically. And so we met, supply chain, internal audits, and myself met with the Comptroller's Office on May 3rd to respond to those findings before they issue a preliminary draft report. And we, some of the important things that came out of that meeting is that we stressed to them that this audit took place during the pandemic, and we were not, so some of our normal procedures in terms of documenting inventory and distributing inventory had to be adjusted to accommodate for that, the pandemic and the urgency surrounding the need to supply certain nursing homes with the PPE. And they understood that and indicated that they would acknowledge that in their report. We also discussed they had in their findings on Carter noted discrepancies in the perpetual inventory and on hand. We explained to them what the reasons for that were in terms of, like, for example, items that were donated did not have expense numbers associated with them, so they might not have been in PeopleSoft, where the other inventory items were kept, and they understood that. There were also issues regarding how we explained to them how we distributed, particularly with regard to Carter, how we distributed supplies to the nursing units at Carter. And so I made them understand that this was the process that we used. So they understood that. So I think that there were some things that we understood, that we explained to them, that responded to their questions during that meeting on May 3rd.
And are they focused more on deviations from what would be standard operating procedures? Is there some concern about fraud or the potential for fraud, anything like that?
I don't believe there's any concern about fraud or potential for fraud, but they did, seem to, believe that we were not following standard operating procedures with regard to tracking inventory and dispersing inventory, that there are procedures that should have been followed. And again, we reiterated the reason for that, which they understood. And so hopefully that will be taken into account when they do the report. I think they're going to issue a preliminary draft in addition to a draft. So we'll have more opportunity to respond.
So are they using Carter as a case study, or they're going to do each one of the nursing homes?
No, they found particular issues, I think, with Carter that were not present in some of the other facilities. So that's why they put additional focus on Carter.
Are there any questions from the members? Okay, hearing none, you can continue.
Okay. So the next item is the system-wide review of nurse hiring. This is an internal audit that Internal Audits is conducting to evaluate the onboarding processes of direct hire nurses, agency nurses, and travel nurses. I want to make sure that we have the proper document, their background checks and onboarding processes and verifications. We had a meeting, as I previously reported, we had a meeting on February 23rd with nursing administration to discuss the processes for hiring and onboarding. Nursing provided a list of approximately 7,300 agency nurses, including travel nurses that were hired from September 2020 to December 31st, 2021. The internal audits has also requested a similar list for direct hire nurses. And once that is received, the Office of Corporate Compliance will use rat stats to draw a random sample of nurses from each list. And then internal audits will review documentation regarding the onboarding processes for the sample of nurses.
Are there any questions? I just have a question.
Yes.
This was, sorry. I have a question. This was a follow-up to an audit that we did earlier.
Not that we did, that the Comptroller's Office conducted I believe 2 years ago, when we had a different agency vendor for the agency nurses. We now have a new vendor, Right Sourcing. So we wanted to make sure that whatever gaps were identified previously with our prior vendor don't exist currently with the new vendor.
That's very wise. Okay, Catherine, why don't we move on then?
So the auxiliary audits, we are moving along with that with the outside CPA firm, the Bonadillo Group. They have provided 22 reports for calendar year 2021. And Internal Audits has reviewed and finalized 10 of those. There are 9 compilations and 1 review that are based on the auxiliaries revenues. There are still 3 reports remaining outstanding for calendar year 2020, that being Friends of North Central Bronx Hospital, Elmhurst, and Queens. There has been a delay in the reports for the Queens Hospital Center Auxiliary for 2018 and 2019. Those reports have been pending due to a determination of the IRS's determination of the retroactive 501c3 status. On April 28th, the Internal Audits was informed that IRS did approve the auxiliaries' retroactive reinstatement of their 501c3 status. So those reports should be able to be finished shortly.
Terrific. Any questions? Okay, I have a question. The controller did an audit of the audits of the auxiliaries. Have we had any further communication with them?
On the auxiliaries of
Yes.
not on those. No, there's been nothing new on those since we've been reporting for the past few months.
All right, thank you.
And now I'll move on to the Corporate Compliance Office, starting on page 2. With regard to our monthly excluded individuals and vendors screenings, for the period February 23rd, 2022 through April 19, 2022, there were no workforce members or vendors that appeared on any exclusion lists, and no providers were identified on the Death Master list or the National Plan and Provider Enumeration System. Moving on to the next page.
Okay.
Paragraph 8, with regard to breaches reported during the February 23rd to April 19 period, there were 63 incidents that were entered into our case management system. Of those incidents, 11 were found to be violations of our privacy and security operating procedures. 9 were not a violation, and 43 are still under investigation. Of the 11 incidents that were HIPAA violations and violations of our operating procedures, 9 were determined to be breaches. 5 of those breaches resulted from registration errors, including selecting the wrong patient for registration. 2 involved providing a patient with the incorrect after visit summary or a discharge paper. 1 involved a workforce member who inappropriately accessed PHI for someone who was not under their care. 1 involved posting some PHI on social media. All individuals involved in these breaches were counseled on the requirement to protect the confidentiality of PHI, including using multiple identifiers of patients. And they were required to take Hipaa remedial training. We also had recommended to Human Resources in each instance that documentation of their breaches be placed into the personnel files.
Okay.
We did not receive any.
I just had a quick.
Yes, I'm sorry.
In terms of the follow-up action taken by H&H Human Resources, are there ever breaches that, in terms of degree of egregiousness, I don't know how that ends up being reflected, if there are penalties or?
We would recommend a more more restrictive or more what was the word? More egregious recommendation, disciplinary recommendation. However, there are certain issues that HR or labor relations needs to and take into consideration, particularly with union members. So there's a process for those individuals if they had, so there, as opposed to someone who's not a union member that can be handled directly by HR. But we do recommend harsher disciplinary action for egregious breaches.
Okay, yes. Oh, Fenny has his hand up. Sorry, I can't see. Oh, there he goes. Hi, Fenny.
Hi, Sally. How are you? I just have a question in terms of how is this compared to prior years? I really would like to understand, are these an increase from prior years breaches or are around the same or lower? Do you have that information?
I don't have the exact information, but I can tell you that there has been, we are learning more about what are called contact moves, where they've had to readdress or fix registration errors. So there has been, and we have, and to address that, I've worked with Revenue Cycle in terms of their training for registration clerks on how to use multiple identifiers. And so that's going to be implemented, I believe in a month or two, they're going to start implementing that training to make sure that we can avoid as much as possible these particular errors from occurring.
Will it be possible that, in future reports, we have a sense of how this compared to prior years and periods, so to have a sense of the scale?
Yes, absolutely.
Thank you.
Thank you, Fenny. Are there any other questions? All right, if not, we'll move on then.
Okay. Moving on to page 4, we received 80 compliance reports through our either through our helpline or directly reported to us. There was 1 red report, 35 yellow reports, and 44 green reports. The red report was made by an anonymous reporter who reported a concern regarding patient abuse, but did not continue to complete the reporting process. Therefore, we had insufficient information to investigate that particular report.
Catherine, is this the area where, this is civil rights, we had a backup because we were short on staff? We were waiting to hire additional staff to help with the backup.
A backup of the cases?
It was backup with the cases, yeah.
Well, there has been short staff, but we have added another person and to broaden so that we can have fewer facilities assigned to compliance officers. They're each assigned to a facility or a program. and they're responsible for all the compliance reports and HIPAA violations that come out of their facilities.
Mhm.
So, and they respond to them. We use Ethics Point as our database for all reports and HIPAA violation reports, compliance reports and HIPAA violation reports.
Mhm.
And they do the investigations and do the follow-up. In the cases of HIPAA breaches, we obviously send out the breach notification letters to the affected individuals.
Okay. Are there any other questions? Okay, we'll move on.
Page 8. As I've reported before, we are soliciting vendors for billing and coding auditing services. It was posted in the city record on March 4th. The vendors will provide data analysis to identify areas of risk, conduct chart reviews, conduct and coordinate training where deficiencies are noted, as well as train staff on billing and coding auditing procedures, and conduct periodic risk assessments. The proposals were due on April 5th, and we received proposals from 6 vendors. The evaluation committee has scored those proposals, and the evaluation committee will invite back the highest scoring proposals to make presentations.
Okay, and I know I asked a question about the size of the funding that would be required, but since they're having this back and forth, I think we're not going to really know that for some time.
Right.
And just for clarity, this is all billing and coding, so it doesn't have an impact on what we do on our financial statements.
Correct. I mean, not a huge impact. I mean, they will identify, it's pre-billing for the most part. So no, it should not have an impact on financial statements because for the most part, the auditing will be conducted on pre-billing claims.
Okay, and when you say pre-billing, what
They
is
haven't
that?
submitted a bill yet for a claim.
Okay. Any questions? You're stunning them. Okay, let's continue.
On the fiscal year 2023 risk assessment, as I reported previously, the Office of Corporate Compliance developed the draft FY 2023 risk assessment, which I presented to the Enterprise Compliance Committee on March 24th. And they reviewed and discussed the risks identified in that. And based on that, I revised the draft risk assessment and presented it to the ECC again on May 5th for further discussion. They had some additional comments to the revised draft, so I will again take those comments we'll revise the risk assessment in accordance with those comments and redistribute it for their approval. Once the risk assessment has been approved, I will prepare and distribute a draft fiscal year 2023 corporate compliance work plan. Once the committee has approved the corporate compliance work plan, it will be presented to this audit committee for approval.
This is a very important document.
Yes.
It's going to really lay out the groundwork
Yeah.
for what we'll be focusing on.
Any questions?
Any questions? All right, there are no questions.
Finally, on page 9, as I reported previously, we are conducting our annual HIPAA risk analysis and security assessment. They have Coalfire Systems Inc., which has been doing our risk analysis in previous years and was awarded the contract again for the next 3 years. In April, they conducted reviews of the acute care facilities, and they will be conducting on-site reviews of selected facilities during the month of May. They've already, excuse me, actually begun some of those on-site reviews where they go through the facilities and are able to view any discrepancies or areas of concern that they might have with regard to any security risks or HIPAA regulation HIPAA regulation compliance areas.
Okay.
Any questions?
Any questions from committee members? If there are no
That
questions,
concludes my report.
terrific. We're at the end of the agenda. Is there any old business to be discussed? Any new business? There being no further discussion, the meeting is hereby adjourned. Thank you all.
Thank you, everybody.
Thank you.
This meeting is no longer being recorded.